January 3rd, CaptureProof released curbside.captureproof.com. It's Snap and Chat for doctors, one-time URL, 24-hour access, 8 minutes to see the data, and then poof, unless you want to save it into CaptureProof. And I'm going to tell you about CaptureProof right now. We believe that we have been so lucky to be part of a revolution. And this social revolution has taken the act of seeing the Pope being named in 2005 and 2010 to this. Each of those white lights signifies someone who is taking a photo or a video to better explain a story. And it's a story about the Pope, not their health. And while managing photography for clinical trials, I realized that it didn't take long for data sets to look like this. I personally renamed 13,000 media files in order for them to be in a process and progress that we could hand over to the FDA. If a doctor has hundreds of patients creating thousands of photos, how in the world are they going to really accept them via email? CaptureProof has done 7 clinical trials, and in those clinical trials, the numbers are astounding. We believe that doctors do not run on time, and so asynchronous telemedicine is the way to move forward. We have reduced by 75% in-person post-op visits for total knee replacement follow-up care. The provider is able to send out a video with what you're supposed to do. You do what you're supposed to do, and then in 3 clicks, you can see A versus B, either you versus the video of instruction or yourself. CaptureProof has 80% more accurate triage. We're opening up that pre-appointment time so you actually know if the patient needs to come in or not. We're eliminating those wait and see visits so that you can actually just see and know what's going on. CaptureProof has 71% more, or not more, just 71% accurate diagnosis remotely. And 60% of the resources were saved post-total knee in the group that used CaptureProof. So as you're looking at bundle payments, we're the answer. There's a Japanese proverb that says, a 3-hour wait for a 3-minute visit. This is a not American problem, this is a global problem. And we want to keep patients out of the waiting room. So how do we do it? CaptureProof has a smart medical camera. We take over the camera on your iPhone. And we do that with a media prescription going out that's text overlaid in the active camera. We overlay the initial image so that you get the same alignment. And then also employ computer vision, highlighting shadow and exposure. We take that a step further with a 3-click curation so that you can see A versus B and easily track through time. And then collaboration can happen in the system. Either the patient is involved in the conversation, or you can have a professional conversation and leave the patient out. We are the visual health record for medicine, but what we believe we will be in the future is also the visual health lab, enabling you to put a photo or a video through an algorithm, and we'll have figured out an amplitude of normal so that 7 days post-op, the delta red in your knee is totally okay, or you get alerted to take a look. CaptureProof is creating spatiotemporal lines for movement so that there is objective data for a delta to be seen over time. We are able to identify when there are sutures in an incision site, and CaptureProof can also tell you that these sutures have been removed. CaptureProof is looking at color and texture so that we're able to identify a wound and the delta in that. We have a doctor up at UW who says he cut 11 fewer legs off of patients in 2015 because he was able to keep up with their wounds like never before. We're working with a team in Paris to identify the health of liver at transplant, their dial size, and putting it through to improve the health of that liver. We're able to take a data set like this and tell you that these are the 2 good organs to put in. We're really excited about the lily pads that are being built in medicine. And we're really excited about what we're able to do with putting that eye in the hand of the patient and enabling clear communication from that patient/consumer back to their own doctor. We urge you to tell your doctors about CaptureProof. Thanks.
Fantastic. Yeah, can I have the mic? Thank you, Megan. Just a couple of questions for you.
This is the hot seat.
Yeah. You talked about the clinical trials that you did. Could you tell us a little bit more about those and what you really learned from those clinical trials?
Yeah, so we've had 53 subspecialties use our product. It was really important to create a whole hospital solution and not have something niched really deeply into wound, or you don't create an x-ray machine for an arm, you create an x-ray machine for health, and we believe this is essentially similar to that. So our clinical trials and the three main areas that are really pushed up are epilepsy. We're automating the Parkinson's scale with Cornell, both looking at triage of epilepsy and diagnoses of epilepsy. We've had a bunch of wound trials that are going on, looking at that delta over time. And then in addition to that, the total knee replacement study that we did with Kaiser. So Kaiser looked at total knee replacement, 60% of the resources saved. And that really is an improvement that impacts everybody as we're moving to bundle payments. And just a shout out to the three Mayos, Yale, Penn, Brown, Baylor, UCSF, and University of Southern Florida that did our epilepsy trial. We just released some data at American Epilepsy Society.
Thank you very much. And just thinking back to the panel discussion, what are we talked about limitations and things. What are the hurdles that you really need to try and overcome to accelerate your growth? And how do you think?
Well, Anthem, I'm coming for you. You said it when you were up there. If it's 6 years on average to get there, we're at year 5. I believe that the 7 clinical trials really gives the opportunity for us to have actual scientific data. We like to look at disruption and Uber and break the rules. And, there's some really important things we need to keep in mind. One of them is privacy. If we do not have privacy in our health records, they will not be accurate. So privacy is paramount, and we should all demand it as consumers and having our health records. This is our data. And then in addition to that, having the ability for people to put on the line their trust and the ability for a startup to actually execute. And I think that it's been a growth process for both the partnerships and the startups. But I think we're at a really good time now.
Thank you very much, ladies and gentlemen. Capsa Proof.